Our next guest is a 26-year-old woman with 2 college degrees. And despite both diplomas, she's not been able to land a well-paying job, at least that's full-time, and she's struggling to get by. Now, that was before Obamacare even took effect. Now she says things are worse under the Affordable Care Act. Her monthly insurance cost has risen from $75 a month to $319 a month. Well, she vented her frustration on the Facebook page of conservative syndicated radio talk show host Dennis Prager. Here's what she wrote. Liberals claim this law would help the poor. I am the poor, the working poor, and I can't afford to support myself, let alone older generations and people not willing to work at all. This law has raped my future. It's going to keep me and kids my age from having a future at all. Joining me now, Ashley Dionne, who wrote that very terse Facebook page post. Ashley, when you went to college, you thought, okay, I'm going to work hard, get a degree, get out, get a nice job, support myself. What's happened instead?
Unfortunately, it's just been a struggle, and I think that I'm not unique in that regard, that all of the kids that I went to school with and friends from other colleges are experiencing the same thing. They don't have work in their field. They're taking whatever they can get, and we're really competing with kids who just have college or just GEDs and high school diplomas for really low-paying jobs. And
you said in the Facebook post that Obamacare had raped your future. What do you mean by that?
Basically, I actually was given a hard time for my use of the word, and I mean it in, a simple definition as far as to plunder or to steal. I feel like our future has been stolen in that we don't have a choice in this. They're saying you have to buy this whether you want it or not, and whether you can afford it or not. And I'm someone who's always worked hard, and I'm being told you have to get on Medicaid. I don't want to get on Medicaid. I want to work, and I feel were it not for Obamacare, I could get 40 hours, I could support myself.
Now, you paid $75 a month for a health policy. That was a very reasonable cost. Now it's $319.
Yes.
Why has it gone up so much? What do they tell you?
I actually called my insurance company and I said, I need prescription coverage, and what do I have to pay to keep this plan, because this is the plan that I want. And they said, you're going to have to get this preferred bronze plan. With your deductible, it's going to be $319. And it bothers me so much that we heard over and over, if you like your plan, you can keep it. And that turned out to be completely false.
You liked your plan, didn't you?
Yeah, very much.
But you don't get to keep it.
I don't get to keep it.
So if you were to get a new plan with your existing coverage, it's going to cost you about $6,000 deductible. Now, can you afford that?
Absolutely not.
So what do you do?
I know that it goes against my beliefs to get on Medicaid, and I really am just leaning towards paying the penalty and just not having that coverage that I need, just because I can't see myself taking aid that I know other people are much more deserving of.
And Ashley, the penalty is a lot less expensive than the cost of the health care, right?
Absolutely.
So how much, how much was the penalty going to cost you versus the $319 a month?
It's 1% of my income, which is not a lot of income.
So right now, that's a real low figure, huh?
Exactly.
Yeah. That's what's frustrating. I mean, you want to work, you want to provide for yourself. Mm-hmm. The government has created a policy that almost punishes and penalizes you because you want to do it for yourself. Mm-hmm. How does that make you feel about the government right now?
I feel awful. I feel like we're being set up for failure because so many of us who have worked so hard don't have the opportunity for success anymore. And at the same time, they're punishing people who are already successful. Mm.
Ashley, I'm afraid your story is going to be told just like that all over America, but I appreciate you coming to tell it here. It's great to visit with you. Thank you very much.